Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today, we're learning about respectful maternity care. So go ahead, subscribe, and let's get started. Respectful maternity care, or RMC, simply means treating every pregnant woman with respect, kindness, and dignity throughout her pregnancy, during labor and childbirth, and after delivery. Think about it this way. When a woman comes to the hospital to have a baby, she may feel anxious, scared, or uncomfortable. As healthcare professionals, our responsibility is not only to provide medical care, but also to make her feel safe, respected, and supported. For example, before performing any examination or procedure, we should explain what we are going to do and ask for her permission. We should maintain her privacy by using curtains or screens, speak politely, listen to her concerns, and never shout at or ignore her. So, in simple terms, respectful maternity care means providing safe, compassionate, and woman-centered care while respecting the mother's rights, privacy, choices, and dignity at every stage of maternity care. Let's look at the definition of respectful maternity care, or RMC. According to the World Health Organization, respectful maternity care means providing care to all women in a way that protects their dignity, privacy, and confidentiality. It also means ensuring that women are free from any form of harm, abuse, or mistreatment during pregnancy, labor, childbirth, and the postnatal period. In simple terms, RMC is about treating every woman with kindness, respect, and compassion. For example, explaining procedures before doing them, asking for consent, maintaining privacy during examinations, and providing continuous support during labor. The main idea is that every woman has the right to feel safe, respected, and supported throughout her maternity journey. Now let's discuss why respectful maternity care is important. First, it promotes a positive childbirth experience. When women are treated with kindness and respect, they feel more comfortable and confident during labor. Second, it increases maternal satisfaction. Mothers are more satisfied with the care they receive when their needs, preferences, and concerns are respected. Third, it encourages women to choose institutional deliveries. When women have positive experiences in healthcare facilities, they are more likely to return for future care and recommend the services to others. Fourth, it helps reduce maternal and neonatal morbidity and mortality. Respectful care improves communication, timely interventions, and adherence to treatment, which ultimately leads to better health outcomes. Fifth, it strengthens trust between healthcare providers and women. Trust is essential for effective care and cooperation during pregnancy and childbirth. Finally, respectful maternity care improves the overall quality of maternal healthcare services by making care more patient-centered, safe, and effective. Now let's look at the first principle of respectful maternity care. The first principle is respect for women's dignity. Dignity means treating every woman as a valued individual, regardless of her age, education, religion, or social background. As nurses, we should always treat women with kindness, compassion, and respect. A simple smile, a polite tone of voice, and listening to their concerns can make a big difference in their childbirth experience. We should never shout at, insult, threaten, or physically harm a woman, even if she is anxious, frightened, or uncooperative during labor. We must also respect her cultural beliefs and values. For example, some women may have specific cultural practices related to childbirth. As long as these practices are safe, we should respect and support them. Let's move on to the second principle of respectful maternity care, which is privacy and confidentiality. Privacy means protecting a woman's personal space during examinations and procedures. For example, when conducting an abdominal or vaginal examination, we should use curtains or screens so that others cannot see the patient unnecessarily. Confidentiality means keeping a woman's personal and health information private. Information such as her medical history, test results, or pregnancy-related concerns should only be shared with authorized healthcare professionals involved in her care. As nurses, we should avoid discussing patient information in public places, such as corridors, waiting areas, or elevators where others can overhear. When women know that their privacy is respected and their information is kept confidential, they feel more comfortable, secure, and confident in the healthcare system. So privacy protects the woman's personal space, while confidentiality protects her personal information. Now, let's discuss the third principle of respectful maternity care, which is informed consent and choice. Informed consent means that before performing any procedure, the healthcare provider should clearly explain what will be done, why it is needed, and any possible benefits or risks. Only after the woman understands and agrees should the procedure be carried out. For example, before a vaginal examination, induction of labor, or cesarean section, the procedure should be explained and the woman's consent should be obtained. Women should also be involved in decisions about their care. They have the right to ask questions, express their preferences, and participate in choosing the care that best suits them. When women are informed and involved in decision-making, they feel respected, empowered, and more confident in the care they receive. So, informed consent and choice are about giving women the information they need and respecting their right to make decisions about their own care. Now, let's discuss the fourth principle of respectful maternity care, which is equality and non-discrimination. This principle means that every woman should receive the same quality of care, regardless of who she is or where she comes from. As healthcare professionals, we should never treat a woman differently because of her age, religion, ethnicity, socioeconomic status, educational background, or marital status. For example, a teenage mother, a woman from a low-income family, or a woman with little education should receive the same respect, attention, and quality of care as any other patient. Every woman has the right to safe and respectful maternity care without discrimination or bias. So, equality and non-discrimination mean providing fair, unbiased, and respectful care to all women, ensuring that everyone is treated with dignity and receives equal access to healthcare services. Now let's discuss the fifth principle of respectful maternity care, which is emotional support. Pregnancy and childbirth can be emotional experiences, and many women may feel nervous, anxious, or fearful. Therefore, emotional support is an important part of maternity care. As nurses, we should provide reassurance and encouragement throughout labor and delivery. Simple words such as, "You're doing well," or "Everything is progressing normally," can help reduce a woman's anxiety and build her confidence. Whenever possible, women should be allowed to have a birth companion of their choice, such as their husband, mother, sister, or another trusted person. The presence of a companion can provide comfort and emotional strength during labor. We should also listen carefully to women's concerns and address their fears and anxieties with empathy and understanding. So, emotional support helps women feel cared for, confident, and emotionally secure throughout their childbirth experience. Now, let's discuss the sixth principle of respectful maternity care, which is safe and evidence-based care. Respectful care is not only about being kind and compassionate, it is also about providing safe and scientifically proven care to mothers and babies. Healthcare professionals should follow standard clinical guidelines and best practices while providing maternity care. This helps ensure that mothers receive the most effective and appropriate treatment. We should also avoid unnecessary interventions or procedures that are not medically required. Every intervention should have a clear clinical reason and should benefit the mother and baby. Patient safety should be maintained throughout pregnancy, labor, childbirth, and the postnatal period. This includes monitoring the mother and baby carefully, identifying complications early, and providing timely treatment when needed. So safe and evidence-based care means giving the right care at the right time, using the best available scientific evidence, while always keeping the mother and baby safe. Now let's discuss the seventh principle of respectful maternity care, which is effective communication. Good communication is one of the most important aspects of maternity care. Women should clearly understand the information being given to them about their health and treatment. As healthcare professionals, we should use simple and understandable language instead of complex medical terms. This helps women feel informed and involved in their care. We should also listen carefully to their concerns, fears, and preferences. Active listening helps build trust and ensures that their needs are addressed appropriately. Women should be encouraged to ask questions whenever they have doubts or need clarification. No question should be ignored, and every concern should be treated with respect. For example, if a woman is worried about a procedure, we should patiently explain it and answer her questions rather than dismissing her concerns. So, effective communication means speaking clearly, listening actively, and encouraging open discussion to ensure that women feel informed, respected, and supported throughout their maternity care. Now, let's look at the components of respectful maternity care during the antenatal period, which is the period before childbirth. The first component is respectful communication. Healthcare providers should speak politely, listen carefully to the woman's concerns, and provide information in a way that she can easily understand. The second component is privacy during examinations. Whether it is an abdominal examination or any other assessment, the woman's privacy should always be maintained by using curtains or screens and ensuring her comfort. The third component is health education and counseling. Pregnant women should receive information about nutrition, danger signs of pregnancy, birth preparedness, breastfeeding, and newborn care so they can make informed decisions. The fourth component is shared decision-making. Women should be actively involved in decisions regarding their pregnancy and care. Their preferences, concerns, and choices should be respected whenever possible. So during the antenatal period, respectful maternity care focuses on good communication, maintaining privacy, providing education, and involving women in decisions about their own health and pregnancy. Now, let's discuss the components of respectful maternity care during the intrapartum period, which is the period of labor and childbirth. The first component is continuous labor support. During labor, women need constant care, encouragement, and reassurance from healthcare providers. Continuous support helps reduce anxiety and improves the childbirth experience. The second component is pain relief measures. Labor can be painful, so appropriate pain management methods should be offered based on the woman's needs and preferences. This helps her feel more comfortable and supported. The third component is respect for preferred birthing positions. Whenever it is safe and medically appropriate, women should be allowed to choose the position they feel most comfortable in during labor and delivery. The fourth component is prompt management of complications. Healthcare providers should closely monitor the mother and baby, identify any problems early, and provide timely treatment to ensure their safety. So, during the intrapartum period, respectful maternity care focuses on continuous support, pain management, respecting women's choices, and ensuring the safety of both mother and baby through timely care. Finally, let's discuss the components of respectful maternity care during the postnatal period, which is the period after childbirth. The first component is support for breastfeeding. New mothers should be encouraged and assisted in initiating and continuing breastfeeding. Nurses play an important role in teaching proper breastfeeding techniques and addressing any difficulties. The second component is mother-newborn bonding. Early contact between the mother and baby helps strengthen their emotional connection and promotes the baby's growth and development. The third component is health education. Mothers should receive information about newborn care, nutrition, personal hygiene, family planning, immunization, and warning signs that require medical attention. The fourth component is emotional support. After childbirth, some mothers may feel tired, anxious, or overwhelmed. Providing reassurance, encouragement, and emotional support helps them adjust to their new role and promotes their overall well-being. So, during the postnatal period, respectful maternity care focuses on supporting breastfeeding, strengthening mother-baby bonding, providing health education, and ensuring emotional well-being for the mother. Now let's discuss the role of nurses in respectful maternity care. Nurses play a vital role in ensuring that every woman receives safe, respectful, and high-quality maternity care. First, nurses should provide compassionate and woman-centered care. This means treating women with kindness, dignity, empathy, and respect throughout pregnancy, labor, and the postnatal period. Second, nurses act as advocates for women's rights. They should ensure that women are informed about their care, involved in decision-making, and able to exercise their right to informed consent. Third, nurses have an important educational role. They provide health education and counseling regarding pregnancy, childbirth, breastfeeding, newborn care, and postnatal health. Fourth, nurses should maintain respectful and effective communication. By listening carefully, answering questions, and providing clear explanations, They help build trust and confidence among mothers. Finally, nurses work as part of the healthcare team. They collaborate with doctors, midwives, and other healthcare professionals to ensure continuity of care and achieve the best outcomes for both mother and baby. So nurses are caregivers, advocates, educators, communicators, and team members who help make respectful maternity care a reality for every woman. Even though respectful maternity care is very important, there are several challenges that can make it difficult to provide consistently. One major barrier is staff shortages. When there are not enough healthcare workers, it becomes difficult to give each woman the attention and support she needs. Another barrier is heavy workload. Nurses and doctors may be caring for many patients at the same time, which can affect the quality of communication and support provided. Lack of training is also a challenge. Healthcare providers need proper education and training to understand the principles of respectful maternity care and apply them in practice. Inadequate infrastructure, such as overcrowded wards or lack of privacy screens, can make it difficult to maintain privacy and dignity. Poor communication skills can lead to misunderstandings between healthcare providers and mothers, affecting the quality of care. Cultural misunderstandings may occur when healthcare providers are not aware of or sensitive to a woman's cultural beliefs and practices. Finally, the lack of supportive policies and institutional guidelines can make it difficult to implement respectful maternity care effectively. So, to improve respectful maternity care, healthcare facilities must address these barriers through adequate staffing, training, better infrastructure, effective communication, and supportive policies. Now, let's discuss the strategies to promote respectful maternity care, or RMC. First, healthcare workers should receive regular training so they understand the principles of respectful care and can apply them in practice. Second, communication skills should be strengthened. Good communication helps build trust, improves understanding, and makes women feel respected and supported. Third, healthcare facilities must ensure privacy and confidentiality by protecting women's personal information and maintaining privacy during examinations and procedures. Fourth, women should be allowed to have a birth companion of their choice whenever possible. A companion can provide emotional support and help create a positive childbirth experience. Fifth, healthcare institutions should establish grievance mechanisms so that women can safely report complaints or concerns about the care they receive. Sixth, the quality of maternal services should be regularly monitored to identify areas for improvement and ensure that respectful care standards are maintained. Seventh, patient-centered care should be promoted by involving women in decision-making and respecting their preferences, needs, and values. Finally, institutions should implement clear policies on respectful maternity care to guide healthcare workers and ensure that respectful practices become part of routine maternity services. Together, these strategies help create a safe, supportive, and respectful environment for mothers and their families. That's the end of this video. If you liked this video, don't forget to like, share, and subscribe to my channel for more nursing learning videos. Thank you for watching, and keep learning.